With the fall and the weather changing and kids going back to school comes the fall respiratory virus season. There are dozens of viruses out there causing nasal congestion, runny nose, cough, fevers, and chances are your child is going to pick up several of them. Your average child gets 8 to 10 colds per year, and those usually cluster in the fall and winter months. Some children may seem to go months without ever being 100% healthy. The virus attacks the lining of the nose and a little bit the back of the throat. It gets the body making more snotty, gooey mucus than it otherwise would, and some of that drips down the back of the throat and gets into the lungs. The lungs don't like to have things there, and the body has a natural reflex of coughing to get that stuff up and out of the lungs. They're caused by viruses. They don't respond to antibiotics or other medicines. But there are some things you can do to help your child feel better. We call normal body temperature 98.6 degrees Fahrenheit, but in general, give or take about 2 degrees to determine whether your child has a fever. And to make that easy, I tell parents to round off to 100.5 degrees. So 100.5 degrees or more, that's a fever. Less than that, and we don't consider it to be a fever. We treat fever based on how it makes a child feel, not the number on your thermometer. So if your child's temperature isn't really a fever, but they're feeling pretty crummy, it's okay to give them some Tylenol or Motrin so that they feel better. Likewise, if that temperature is up, but the child feels okay, it's not necessary to treat it. Now this is true for older kids. For babies under the age of 2 months, you should always have the child checked out if they should have a fever. Infection can run through a small baby's body fairly quickly, and we'd want to be sure we're on top of that. But for older kids, it may be fine to watch a fever. In general, it's not the fever that tells you how severe an infection is, it's the other symptoms that go along with it. Now, having said that, I do recommend that kids be checked out if they're running higher fevers. In general, a child who's had a fever for over 3 days should also probably be checked out by their healthcare provider. There are no medicines that we consider to be safe or effective to treat respiratory symptoms in children. Cough is the body's way of getting things up out of the lungs, and we don't want to do anything that would interfere with that. For that reason, cough-suppressing medicines are not recommended for children and are questionable in older kids and adults too. Better than any medication to help treat a cough is honey. Honey is a food, so you can't overdose anybody on honey. You can give your child as much as it takes to help control their cough and make them feel better. What's more, honey seems to work if you feed it to them off of a spoon, put it on a sandwich, or mix it in with a tea. Any way you'd like to give that to your child should be fine. Remember that babies under 1 year of age should not have honey. It is important to keep your child well hydrated while they're ill. Make sure that your child is drinking well, even if they don't have a great appetite for foods. That can be perfectly normal, and your child can go several days without eating much of anything, as long as they're drinking well. Electrolyte solutions like Pedialyte are great for younger kids, probably not necessary for school-age or older children. Gatorade is a fluid that has some extra electrolytes and is designed as a sports drink. It's not designed to be given to sick children. It's not harmful to them, but it does have a lot of sugar in it that they probably don't need. Ear infections, sinus infections, and throat infections are very common during or after respiratory infections. If your young child is pulling on their ears or complaining of ear pain, particularly if they have fever, it might not be a bad idea to have your child's healthcare professional take a look at those ears. But keep in mind that many ear infections do not require specific treatment. Strep throat is a common respiratory infection, but is not a respiratory virus. It's actually uncommon for strep throat to have nasal congestion or nasal drainage along with it and cough. Strep throat oftentimes has sore throats, fevers, and sometimes upset stomachs or rashes along with it. If your child has a sore throat, particularly with a fever, and particularly if they do not have a cough or congestion along with it, it's a good idea to have your child checked for strep throat. If your child has a sore throat, particularly if it's not very red, or if it has symptoms like nasal congestion or cough along with it, it may be fine to watch it for a while, particularly if there's no fever. You can help protect your child and your family against certain respiratory viruses. The flu is a respiratory virus that oftentimes has higher fevers, muscle aches, and a greater degree of misery than most respiratory infections. The good news is there's a safe, effective flu vaccine that you can get and your child can get every year. I recommend yearly flu vaccines for everybody in the family who's over 6 months of age. Babies under 6 months of age can't get a flu vaccine. The way to protect a baby from the flu is to protect the people around them. So be sure parents and older siblings get their yearly flu vaccines. COVID-19 oftentimes presents itself as an upper respiratory infection. It's particularly dangerous to people who have problems with their immune system or underlying medical conditions. The best way to protect you and your family against COVID-19 is to get your COVID-19 vaccines. There are new boosters that include some of the new strains going around. If your child of any age has difficulty with their breathing or getting their air in and out, be sure to bring them for prompt medical attention. For a baby who's not in any respiratory distress but has a lot of nasal congestion or drainage, you may find it helpful to use saline nose drops and a bulb suction to clear some of that drainage out of the nose. I'll go over the technique for doing this in another video. Remember, your child's doctor may have some different things that they can suggest, so when in doubt, please see your child's doctor or healthcare professional. But most common colds, upper respiratory viruses with nasal congestion, nasal drainage, and cough don't really require medical attention. But a child who's having high fevers, pain particularly in the ears, throat, or stomach, or chest, having any difficulty with breathing, or just any other symptoms that are alarming to you as the child's parent, please have them checked out by a doctor or medical professional. Parenting, you got this. See you soon.